Continuing on, this next slide is a lot more straightforward, right? Starting with the external structures and working our way back, we'll start with the conjunctiva. We've already discussed how the conjunctiva is a thin, transparent mucous membrane that lines each eyelid and sclera. It is divided into palpebral, upper eyelid, and bulbar, lower eyelid regions. The cornea is the first structure of the globe, belonging to the anterior chamber, which is responsible for refracting light. It is avascular and transparent. Everything we see must travel through the cornea first, which is what leads the corneal transplant procedure to such incredible results because it is a procedure that restores sight to the visually impaired. Next up is the sclera, which connects the ends of the cornea and makes up the remaining 75% of the globe. The cornea and sclera are considered extraocular. Eye muscles connect to the sclera, thereby making them extraocular structures. Everything between the cornea and sclera are considered intraocular. This is important because you need to know whether the procedures you're doing are on soft tissue, extraocular structures, or intraocular structures. Behind the cornea is the iris, and we've already discussed that at length. Behind the iris is the lens. The lens is held in place by suspensory ligaments. There's a particular medication on your medication study guide that breaks those ligaments down in order to perform a cataract procedure. The lens is convex and it is supposed to bend to refract light onto the retina so the retina can receive focused images to transmit to the brain. If the lens doesn't bend like it's supposed to, it refracts a blurry image onto the retina, which is subsequently transmitted to the brain as blurry. This slide is not a part of your printed notes, but make a note in the margin about these common conditions of the lens. Although these conditions don't typically lead to surgical procedures, ophthalmic surgeons will expect you to know the terms when they're used. So here you see hyperopia is farsightedness. Presbyopia is a specific type of farsightedness that usually is related to age. And myopia is nearsightedness. Okay? Here you see the lacrimal apparatus. What I want you to understand is that the lacrimal apparatus functions much like a sink and faucet. The faucet in this analogy is the lacrimal gland. When the faucet turns on, water flows in the form of tears. These tears, along with our conjunctiva, keep the cornea moist. It's important to understand it is the cornea that is moist instead of the layman's term, eye. If you simply say the eye is moistened, you could be implying that it's any of the other anatomical structures we've learned about. It's the cornea that is moist. Back to the sink again. So the water is going to drain from the outside of the eye through the nasolacrimal duct, which empties into our nose. Now you can understand why your nose runs when you cry. The lacrimal gland is a continually functioning sink because the cornea must continually be moist. And it's when there's an overflow that you experience tears on your face and notice them in your nose. Otherwise, it's a constant thing, which, dun dun dun, can help explain the necessity of the lacrimal duct surgical procedures we'll be discussing next week. In those procedures, it's like the sink is clogged. So this is the last slide devoted to A&P. Please write down any questions you have so we can discuss them together in class. We'll do a brief overview of the content and have a couple activities planned for the beginning of class before you start your homework. Now we're going to talk about the perioperative considerations regarding ophthalmics. First is diagnostic testing. The following tests, much like all our other units, are performed prior to surgery being scheduled. Beginning with refraction, so as not to get confused, refraction is one of your medical terms in this unit, but when we're talking about it in the sense of diagnostic testing, we are testing the patient's ability to refract images. This is the basic eye exam, determining if a patient is in need of corrective glasses and/or contacts. Fluorescein angiography is a unique diagnostic procedure that allows us to stain the cornea and epithelial tissue of the globe either by direct installation or by IV injection, and once it reaches the retina and the vessels of the retina, an angiogram is performed, which is used extensively in the diagnosis and evaluation of retinal and choroid diseases. Ophthalmic ultrasound is used to measure the density of eye tissues, and MRI and CT are used to evaluate orbital and intracranial structures. The psychological considerations we must be aware of are significant to the patient and how they end up perceiving the care they received. The biggest fear these patients have is losing their eyesight as a result of their procedure, and that's a very real risk of ophthalmic surgery. It's important to note that most of the patient population are older adults, and they require individualized care that takes into consideration the environment of their procedure. Things like the temperature, the choice of anesthetic that's used, the volume of conversation, and specific post-operative instructions are all key factors to a successful surgical procedure. It's important to understand that most of these patients will be under conscious sedation. Therefore, they're awake and able to hear what's going on. Keep the room calm, quiet. Should a patient be unnecessarily startled, chances are they'll react and move their body, and even the slightest movement can lead to injury in the operative eye. Finally, should the patient be abnormally anxious or made anxious for any reason, their blood pressure will likely rise, which will ultimately lead to hemorrhage in the eye. That increases intraocular pressure, which can lead to blindness as well. We obviously want to eliminate the chances of these complications if at all possible. It's imperative that the entire operative team verify the surgical site. Every case, every time, everybody. It is recommended that the surgeon make a mark on or around the operative eye. However, that should not be the only method of verification. Check with your patient when they enter the OR to ensure you're prepared for the correct surgery. One of our very own Neosho County Surg Tech students prevented a wrong site surgery simply by paying close attention during the timeout. They single-handedly prevented a sentinel event in which the wrong body part could have been operated on. Most patients usually arrive on a specialized eye cart that acts as a transport cart and an OR bed all in one. That means that turnover times are decreased because there's no patient transfer or bed to clean and make. That's one leading factor as to how certain facilities can churn out 15 eye cases in a single day. Additional considerations include they are positioned supine, stabilized on a donut, and are made comfortable with blankets and pillows when needed. The correct eye is routinely prepped with a diluted betadine solution. It is important to know that the solution must never be stronger than 10% strength. It can be diluted to less than 10%, but it can never be stronger than 10. The canthus of the eye, do you remember where that is considered contaminated. So although it's a part of your field, don't purposefully use any of your supplies on it. Finally, when draping, there are a variety of drapes and techniques used, from adhesive drapes with a cutout for the eye to turban drapes similar to ENT head cases. The hairline and non-operative eye should not be in your sterile field. We discussed briefly already that many ophthalmic procedures are performed with regional anesthetic or monitored sedation. You received a handout at orientation that shows you how a retrobulbar block is administered. This specific anesthetic block is given after the patient is anesthetized or sedated because it can be very uncomfortable. Patients of the pediatric population will not adhere to these guidelines and will instead receive a general anesthetic due to the fact that they are not expected to remain still during these procedures.